So this is going on with the WHO, and I've been monitoring that, as well as I've been noticing some really interesting turn of events that are occurring also within the medical system regarding the COVID. That's really disturbing.
Today we're going to talk about contact tracing. Have you heard of this? There's some excerpts from a Clinton Global Initiative University meeting that was held over Skype a couple weeks back, I guess, and it's all about this notion of contact tracing. Here's some excerpts so you understand what they're talking about.
We need tracing agents in the hundreds and hundreds of people, right? You take the test and then you trace back all the contacts. It's never been done on this scale before. This is an army of tracers. They're basically investigators. We will do that the best we can with this 7-state consortium. But it could have been done from the federal government on a much tighter, more efficient basis.
So that's Andrew Cuomo, and this is Bill Clinton, former President Bill Clinton.
Very important. And it could enable our entire country for the first time to have a real public health system, a real public health corps. And I've thought about it in a lot of different ways. Could we make this a part of AmeriCorps and encourage people to come and do this work and earn some credits to go to college, for example? Is there some other way we could do it? But I know that my friend, whom you know well, Paul Farmer.
I just want to interject here. What they're talking about and discussing is helping individuals through college for being contact tracers, individuals that will go out to the homes to people that have tested positive for COVID-19 to talk to them about how they contracted COVID, what were they doing, who were they talking to, what were their activities, things of that nature, and also providing resources.
And is heading up a program for Massachusetts now to try to get a state contact tracing corps.
We are asking people, thousands of folks, to be part of this new corps, to get trained and to help us with the tracing, because you're absolutely right. The predicate for getting back to some semblance of normalcy is our ability to identify individuals through testing, to be able to trace their contacts, to isolate individuals that have either been exposed or quarantine people that are tested positive. And that's just going to require an army of folks and the capacity of consideration from individuals to allow for their privacy to be impacted by that kind of acuity of attention based upon where they've been and who they talk to.
You can see that they plan to work with whoever will work with them, whichever state governments will work with them, to build an army of medical Gestapo, medical inquisitors. This is like a grand inquisition based on positive test results for this stupid virus. So if you go in, you test positive for the stupid virus, these people, if you live in the wrong place, these people will call you and they will quiz you about everyone you talk to and everywhere you go. And then these people, these medical tyrants, will call the places you've been, and they will call the people you've been in contact with, and they will quiz them. So one of the things this hinges on is, of course, the tests. So now you can see why there's been this massive competition to be the company that provides the tests. Because obviously, the bad guys, the cabal, the medical tyrants, the eugenicists, the medical Gestapo, they need this information. They need the test results, right? And obviously, for their purposes, the higher number of positive tests, the better. Today, Donald Trump says the only reason the U.S. has reported 1 million cases of coronavirus is that our testing is so much better than any other country in the world. Other countries are way behind us in testing and therefore show far fewer cases. So there you have it. You're doing a lot of testing in the United States. So this whole contact tracing army that they're building will first be built in the United States. So you guys are going to get it the worst of all. We're going to get to the legality of this, touch on it at the end. I mean, it's probably a violation. Wouldn't you think? How is it that people from an NGO, people from something like the Partners in Health, which we'll talk about in a minute, how are they getting their hands on test results? They must be working with the companies that provide the testing. So already we are seeing the public health establishment sliding up beside the actual medical establishment, undermining it, and possibly going around the laws somehow. And it's this partnership with giant corporations and philanthropy that I addressed in my last video. They have nefarious aims in mind, but they cloak themselves in public good, in humanitarianism, in philanthropy. To get us in the mood for what I'm going to talk about, let's look at this paper, In the Name of Public Health, Nazi Racial Hygiene, by Susan Bacharach, PhD. In democratic societies, the needs of public health sometimes require citizens to make sacrifices for the greater good. But in Nazi Germany, national or public health took complete precedence over individual health care. Physicians and medically trained academics, many of whom were proponents of racial hygiene or eugenics, legitimized and helped to implement Nazi policies aiming to cleanse German society of people viewed as biologic threats to the nation's health. Can you get your head around it? Because in this case, it's not racially based, but it is the same thing. Please try to separate out the...
So I'm going to pause it there for just a moment because I also want to talk about something else. I want to talk about a little bit about, this originally was an outbreak out of China, and the WHO, major stakeholders are Chinese investors, and it's really disturbing to me when we have Governor Newsom 3 weeks ago who secretly signed a $1 billion mask contract with a Chinese company, breaking protocol by wiring $500 million up front. The deal, he announced the deal on the Rachel Maddow show. And I don't even know if Congress was aware of this, but the company BYD has a history of supplying allegedly contaminated products from to the U.S. With COVID-19. That had ties to Chinese military and the Communist Party, and possible links to forced labor as well. I'm just going to assume that. The governor refuses to release the contract and has blatantly stonewalled legislative requests from both parties. This was written by the Sacramento Bee, and I posted this to the Social Media News Network. And I think currently we still have no idea if the masks will arrive to the United States. And the governor has suggested that we might get stiffed despite already spending $500 million. I think this went to, from what I understand, industry leaders in Shanghai that were supposed to manufacture these masks in China. So, we still are vulnerable to getting flooded with possibly contaminated masks. So I just wanted to add that. I just wanted to note that.
The whole World War II narrative from this other part, which is just the science, okay? Separate those two things out, and you're going to see that it's exactly like what we're going through right now. Don't get triggered by the Nazi thing or the Jewish thing or any of it. Just listen to what happened. Breakthroughs in bacteriology and the emerging field of genetics, the publication of August Weismann's theory of immutable germplasm in the 1890s, and the rediscovery of Gregor Mendel's laws of heredity in 1900 seemed to promise biologic or medical solutions to Germany's problems. Physicians and medical researchers began to view themselves as the guides to a healthy, moral, industrious Germany. I believe that's what we have seen happen over decades in the West. And the smoking thing is part of it. It was huge in Nazi Germany. And then for some reason that all died out and we were smoking and we were, not bothered by the public health regime. And then all of a sudden that all came roaring back. And there's been countless others. Nutrition things, exercise things. They're trying to tell us how we should live our lives, and they're doing it under the guise of public health. Sugary drinks, the